a number 11 blade, an airway in the form of either an endotracheal tube or Shiley tracheostomy, varying sizes from 4 to 8.0, a 10 cc syringe to allow for adequate inflation of the tube cuff, where available, suction, prep, and an O2 source. In terms of patient positioning, the patient should be in a supine position with their head in a neutral position. If there are no concerns for an unstable cervical spine injury, then the patient may be placed in an extended or sniffing position. Prior to inserting the definitive airway, the cuff should be inflated to ensure that it is intact. From the standpoint of the approach and exposure, the operating surgeon should stand on the right side of the patient. The key step in this procedure is palpating the cricothyroid membrane, which is located between the thyroid cartilage superiorly and the cricoid cartilage inferiorly. Prior to creating an incision, it is important for the surgeon to stabilize the tracheal laryngeal complex with the left hand. The incision should be placed directly over the cricothyroid membrane using a number 11 blade. Technical points. There is debate among surgeons with regards to the optimal type of incision, whether it be vertical or horizontal. Advocates of a vertical incision state that it is an extensile incision and may help to avoid iatrogenic injury to the anterior jugular veins. Those that advocate for a horizontal incision state that a single incision may be created, which is taken through the skin as well as subcutaneous tissues and directly into the airway, thereby avoiding two separate incisions. Difficulty may be encountered upon inserting the actual endotracheal tube or tracheostomy. To this end, the handle of the knife may be inserted and rotated 90 degrees to create a larger opening within the actual airway. Alternatively, if available, a hemostat or tracheal dilators may be inserted into the cricothyrotomy and then spread, thereby allowing easier insertion of the definitive airway. If insertion of an initial endotracheal tube or tracheostomy proves difficult, then inserting a tube of a smaller diameter may also be beneficial.